Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Ambreen and I'm the course instructor of the subject Physical Agents and Electrotherapy 1. This course is for the students of Doctor of Physical Therapy Semester 5. And at this session, we are going to discuss about the electromyography. I'll tell you the learning objective of today's lecture, then we'll go towards the details of electromyography that we are going to cover in this session. So let's discuss the learning objectives. We'll also discuss the key points of the last lecture. And after the end of this session, you're going to understand that what is electromyography and simply to which we say EMG. And what are the types of the EMG? And why, being a physiotherapist, we prefer to do EMG. You will be clear out about all these things and will be able to better explain that what it is, and what we are going to do what it is going to tell us, how the muscle is going to behave in different conditions and with different situations. So let's revise initially the last lecture so that we must be all in one page, then we will move towards today's lecture. And the last lecture, we have studied about electrodiagnosis. Electrodiagnosis is a method to obtain information about a disease by passively recording the electrical activity of the dead body part or by measuring the responses to the external stimuli. Now we're going to continue with our topic, that is electrodiagnosis. For this, we are going to revise some basic terms or basic understanding points, that what is the motor unit action potential and what it is, the normal parameters of the normal muscle action potential, and how they are going to get varied in case of different diseases or different issues. The motor unit action potential is the sum of the action potential that is produced in the muscle. So when a muscle is going to contract, there are a number of the muscle fibers in the muscle that are actually going to contract. And the surface undergoes a state of depolarization and the action potential is recorded from the fiber. When the fibers of motor unit fibers are activated, they contract nearly but not quite synchronously. Action potential is added up and relatively large complex action potential is coming across to us, that is the motor unit action potential. This action potential is the combined effect of all the muscle fibers that are present in that muscle. And our EMG that we are going to start today is going to give us some information regarding that action potential. And the EMG pattern is usually the summation of the individual action potential from the fibers, consisting that muscle or muscle being measured. The next is what is electromyography, that about which we are going to discuss in detail. As the name is indicating, electro mean electrical activity and the myo mean related to muscle. Fine. So we can say electromyography is a clinical technique that involves the recording of the electrical activity generated in the muscle for some diagnostic purposes, that provides the information regarding the structure, the function of motor units present in the muscle. So let's revise it again. I said electromyography is a clinical technique that involves the recording of the electrical activity that is generated in our muscles. And why we need to record this electrical activity? For diagnostic purposes. And that provides the information regarding what is going inside the muscle, about the structure, about the function of the motor units. Fine. And the graph or graphical representation of all those electrical activity that are associated with the muscle action is said to be electromyogram. Like we have seen the ECG. ECG is electrocardiography. Is the measure or our ECG or electrocardiogram is actually representation of the electrical activity of the cardiac muscles. And the technique with which you get ECG electrocardiogram is electrocardiography. And here we have is electromyogram. The bioelectric potential associated with the muscle activity is recorded over a sheet, over a paper in the form of graphical representation. Is it electromyogram? Now, what is the need? Why we measure electromyography? Actually, the signals can be analyzed or detect the medical abnormalities, the activation level, the recruitment order, or to analyze the biometrics or biomechanics of the human movement. EMG means our electromyography doesn't tell us the strength of the muscle, what type of the movement the signal represents, whether the activity is compensatory or the primary abnormality. I just give the picture of how the muscle can behave in simple terms. There are different types of electromyography, like the one that is being used for diagnostic purposes or clinical EMG, the other one is kinesiological EMG. What's the difference between the diagnostic and kinesiological EMG? I'm going to tell you. Diagnostic EMG is for the diagnostic purposes for electrodiagnosis. We use it for the study of the diseases of the muscle, the neuromuscular junctions, and of the nerves. What we do is we are going to cover or get a muscle that is being recorded from the muscle activity and going to convert and give it to amplifier, and that is going to give us the signal or output into two different ways. Either it gives us visual representation or it gives us audio representation. So action potential from the skeletal muscle fibers are recorded and they are analyzed for the study of the disease processes. We watch or we get the information and we compare it with the normal muscles, and then we are able to explain this in which condition usually this happens. And disease in which the motor neurons are affected, the action potential obviously get varied, and we are going to record that motor unit action potential. The next one is kinesiological EMG. It includes the study of the muscle activity or the various muscles on a specific activity. We document the effects of the treatment on the muscle impairment, examine the muscle function during specific purposeful tasks or therapeutic regimes. Want to get the information and want to compare it for study purposes or for the different relevance of the link with the rehabilitation, we actually do this kinesiological EMG so that we may document their effect or their impairments and we may compare it. Let me tell you about the phases of the EMG. The phases of electromyography. Phases mean the steps of electromyography. Initially, what we do is we start from the signal and get it picked by different electrodes. The signal is being picked up and then it is sent to the amplifier for the filtration or amplification, and where it is going to convert into an analog signal to the digital signal. And that is being showed over the computer or cathode ray oscilloscope. The phases of EMG includes three steps. Number one is input phase, number second is processor phase, and the third one is output phase. Input phase includes that electrodes pick up the electrical potential from the contracting muscles, and they are then going to convey to the processor phase where the signals are going to be amplified. As the signals are very small, so they get amplified. And the third one is output phase, where we display and ionize the electrical potential by some visual or auditory methods. Coming towards the component of EMG or electromyography, we have different types of the components like electrodes that are going to pick up the signal. We have an amplifier system, we have a display system. So what are these electrodes and what are the types of the electrodes? There are different types of the electrodes. They are either surface electrode or they may be either needle electrodes. Like these are surface electrodes and these one are the needle electrodes that we are going to insert in the muscle to localize or get the localized muscle action. And the next one is amplifier system. Before the motor unit potential can be visualized, it is necessary to amplify the small myoelectric signal. The amplifier converts these electrical signals large enough to be displayed over the screen. And amplified and processed signals that come across and are displayed in the useful manner. They are displayed visually on the cathode ray oscilloscope or computer monitor for analysis. Coming towards the technique of EMG, usually the needle electrode is inserted in the muscle or surface electrode is applied over the muscle. And circuit is completed between the two electrodes. Any electrical or any current flowing in the circuit is amplified and led to the loudspeaker or cathode ray oscilloscope. Loudspeaker for auditory signals or cathode ray or tube oscilloscope for the graph to get formed. Now we are going to discuss what is the normal behavior of the muscle, what normally the muscle is going to behave when the muscle is over the rest phase. And in our physiotherapy or in electrotherapy terms, we say it's spontaneous activity, that the activity that is at the level of the rest. When the muscle is in the rest phase, what is going to affect? Spontaneous activity at rest, the normal muscle action is, our normal muscle is actually electrical silent or electrically silent. In a normal muscle, when it is going in the normal rest phase, it is electrically neutral or silent. Occasionally, a nerve discharges if the needle near the motor point is inserted. For this, when I am going to do the electromyography of the muscle, which is at the rest stage, and I insert a needle, then what is going to happen in that muscle is going to show you a normal nerve discharge, and that discharge is initially negative in the deflection and of higher frequency as compared to fibrillation potential that we are going to discuss. I'm again going to tell you that a normal muscle when it is on the rest state is electrically silent. But for the EMG purposes, when we insert a needle in that resting muscle, it shows some discharge. And the normal muscle is going to show you the discharge that is initially negative in deflection or of higher frequency. We need to understand the normal way a muscle is going to do, so that when I'm going to tell you about the abnormal behaviors of the muscle, you have the understanding that the normal muscle behaves in this way, that it was electrically neutral, it was electrically silent, and when you inserted a needle, it showed some deflection or some discharge that is initially negative, and meanwhile, it is of higher frequency. And in the normal muscle has certain characteristics that is going to be shown or represented over the screen, and you have to keep all these parameters or characteristics in your mind so that you may be able to compare it with the abnormal motor unit action potential. These are the characteristics or parameters of a muscle that is having to show you normal motor unit potential. In normal muscles, the amplitude of the motor unit action potential is going to vary between 300 millivolts to 500 millivolts from peak to peak, while the duration of the normal motor unit action potential is 3 to 16 milliseconds. The shape the normal motor unit action potential is either diphasic or it may be triphasic, it may be polyphasic. And the nerve firing rate, means the frequency is usually 15 times per second. Please revise it with me that amplitude is between 300 millivolts to 5 millivolts, and the duration lies between 3 to 16 milliseconds, while the shape is either diaphasic or triphasic or polyphasic. While the nerve firing rate of a normal muscle is 15 times per second. These are the characteristics of a motor unit potential of a normal muscle on the graph. If we say what is the auditory signal of a motor unit action potential is, we'll say it is clear, distinct thumb sound or striking stick leg sound. Like if I have a wooden rod, and if I'm going to strike it to something, it gives a sound like this. So this is a sound with which our normal muscle is going to give us. If there is a variation in the sound from this way, then we'll say there is some alteration from the normal way. And we are going to compare it either by the characteristics of the graphical representation of the motor unit action potential or by the sound behaviors or auditory behaviors the muscle is going to give us for comparison as well. Fine. So the normal sound is clear, distinct thump, or you can say striking the stick with something is the sound like this. The next is the abnormal spontaneous activity. This is the activity, or I said, this is normally which is spontaneous activity. If there is some variation or alteration that is liable to occur, we'll say it abnormal. So poorly observed when the needle is at rest, but any activity on the EMG seen during the relaxed state is said to be abnormal. I earlier said the muscle is electrically silent at rest, but if I do EMG, the relaxed state and it show variation or alteration and that are liable to occur if there is some issue, we'll say it's abnormal spontaneous activity. That might indicate that some nerve and muscle has some damage. And the shape, the size, the frequency of the resulting motor unit action potential are analyzed and compared. Abnormal spontaneous activity has been divided into 4 categories. Number 1 is fibrillation potential. Number 2 is positive sharp wave potential. These are abnormal behaviors that has been documented and recorded in different diseases or different impairments. And then we standardize them and we usually compare if a muscle do such variation, it is said to be fibrillation potential. It means it do have such other characteristics. It is such a type of a disease. Fasciculation potential, high frequency discharge. Let me tell you the fibrillation potential. In fibrillation potential, the motor unit action potential actually is biphasic or triphasic. And the duration is 1 to 2 milliseconds. While we said it's between 16 milliseconds. So these are the comparison points that we are going to compare with the normal motor unit potential. The amplitude lies between 300 to 500 microvolts. Will say it comes in the category of fibrillation potential. And spontaneous excitation of individual muscle fibers. When we insert a needle, they spontaneously or abruptly excite all the way as compared to the normal spontaneous activity. And this is that appearance of a muscle that usually appears after 10 to 20 days of nerve degeneration has occurred or nerve injury has occurred. This is not the representation if you are going to do EMG in the first or second day of the nerve degeneration. And finally, we can say that this behavior is going to indicate that ultimately there is a degeneration of muscle has occurred and the nerve has degenerated. And the very interesting thing about this fibrillation potential is when we say about something related to sound, it is going to give us fibrillation, sound rain on the tin roof. You have ever heard that if there is some tin or anything like metallic that is present in your lounge, and in case of rain or in your garden, what is going to happen when the rain is going to strike over a tin roof or a tin plate, or it is going to give you a different tick-tick sound, and that tick-tick sound is fibrillation potential. The next is, these are the waves that I'm going to show you about fibrillation potential. The next we have is positive sharp wave. After fibrillation potential, we are going to discuss positive sharp wave. So let's have a view of the characteristic a positive sharp wave is going to show. Its amplitude lies between 50 to 2000 microvolts. And when we are going to perform this, a sharp initial positive deflection followed by a prolonged negative phase, while the normal muscle behaves in a different way, we show sharp negative deflection and comes towards a normal, while here there is a positive deflection and then there is a prolonged negative phase. And this is also going to indicate the denervation of muscle. And the sound that we do here in such a case is dal, thun, dhamak type sound or chunk sound. It's like you are going to throw a stone or a conker in a water, which is a sort of conker-like sound. Third one is fasciculation potential. Fasciculation potential has an amplitude of 0.5 to 3 millivolts, while it has a duration from 7 to 20 milliseconds, along with it is going to act on muscle twitches that are going to give us like view that we are going to have visible or able to see normally. So when we are going to perform this, the muscle twitches are visible even to the normal naked eye. It also indicates benign myoclonus. Now, what is benign myoclonus? Myoclonus is basically spontaneous fine fascicular movements of the muscles without any sharp or any visible atrophy. And it's related to eye muscles usually, and it tends to progress. It doesn't tend to progress to other muscles. It has some uh, issues with the eyelid movement. It also tells about the pathology at the spinal cord level, about the motor nerve diseases as well. Then we are going to move towards the high frequency discharge. High frequency discharge is considered to be occur in cases of the myotonia or dysphoria myotonica, polymyelitis. The patient who are in the polymyelitis show with these features. And what are they? They are actually going to give you a sound that is dive bomber sound on the loudspeaker. It's a sound that you usually say in case of dive bombers, which are going to show you high frequency discharge. The next we have is overall view of different ways of EMGs. Now we are going to move towards the next phase. Initially we said what are the behaviors of the muscle when the muscle are in rest. Now we're going to see what are the behaviors when a muscle is going to perform any action. For this, we need to go through simple terms that we need to understand them initially. That comes in the way we are going to discuss about the violational activity of a muscle. Violational activity, violational EMG is when the muscle is going to show you the activity, what the violation or what is the movement pattern, we say violational activity of the muscle, the activity behavior of the muscle. So let's discuss interference pattern first. Each motor unit sets up its own action potential, and different motor units are not synchronous and appear one after the other in an irregular manner. We know when a normal muscle gets contracted, all the muscle fiber does not contract simultaneously. They do add on the initial muscle contraction and gives a fine contraction. And so we say that the interference pattern or the pattern with which a muscle unit is going to behave is of different way. That initially if the few fibers has participated, meanwhile the other fibers are also going to participate and gives to the motor contraction. The pattern that is going to represent on the screen is set to interference pattern that actually starts from the smaller motor unit action potential, and then it gives a combined view or pattern how all the muscle fibers are going to perform the action. And if we say that what would be the sound if a normal muscle is going to do activity, then it would be like a gurge sound or it would be like a loud roar. It starts like a line is actually start roaring that start from a low intensity and moves towards a higher intensity. As much you are going to perform the active, for example, if I do this type of contraction, my sound will be different. If I do a breast contraction, my muscle is going to behave in a different way. So my sound activity is going to depend over the participation of my muscle fibers, active participation. Next, I want to tell you about a term that is polyphasic unit. When the motor units are incompletely innervated, they are not getting the enough supply on the attempted muscle contraction. The way it shows or graphical representation it gives us would be said to be polyphasic unit. It is shown in early stages of reinnervation, then the small nerve fibers or motor unit action potential that are very weak or that gradually begins to combine and goes towards interference pattern are said to be polyphasic units. Now is degenerating in the neuropathies. So I said violational activities is the recordings that are made in the minimal violation or at the level of minimum activity with increasing strength of the muscle contraction. The potentials that are recorded from the normal individual muscle vary in their amplitude and their duration, depending upon the number of the muscle fibers that are going to be participate. So we know the motor unit is actually going to further consist of our muscle fibers, the nerve fibers supplying the muscle, and the parent anterior horn cells. And the motor unit of the face are much smaller as compared to the limb, like muscles of the calf. So as a result, the potential that is recorded from the muscle fibers of the face is of smaller in amplitude as compared to the muscle fibers of a calf. Normal motor unit activation or participation or potential at level when it is going to show you any activity have 3 to 4 phases. At first repeat with 10 to 15 times per second. Other units are then going to participate and they're going to fire on and gives us the confused pattern of the electrical activity that is going to be displayed over the screen is said to be interference pattern of that muscle. A small number of the polyphasic units are seen in normal muscle unit. And if there would be denervation and the muscle tends to do activity, as there is a reduction in the number of motor units, there would be obviously reduction in interference pattern. In severe denervation, parts of the baseline are visible even at the maximum violation and call it discrete interference. And with the complete denervation, no motor units are electrically active. As there is a complete denervation, obviously we understand that there is no motor unit and the baseline is like ECG when you have seen in different movies when the hero or anybody in the movie is going to die and the ECG it's going to be a neutral or baseline. There is no electrocardiogram. Similarly, at the muscle has no number of motor units that are getting enough supply. The baseline is normal and there would be no overall pattern over it, and we call this discrete interference. And in case if the muscle tend to re-innervate after any nerve injury, it causes nascent means newly formed polyphasic units to appear. At first, only 200 microvolts polyphasic units are seen over the screen. The next we have is in case what is going to happen in peripheral neuropathy. There is even here reduced interference pattern of the motor units with increasing poly units on violation. While in myopathies, it causes no loss in the total number of the motor unit at first, but the reduction of interference patterns occur later in this disease. A few or high frequency discharges are seen and heard in many myopathies, but mostly with the myotonias. Now let's discuss why we measure this electromyography or electromyogram. Actually, we were measuring the muscle activity during different like situations. Like even when I say about gait, it allows to give us an indication whether which muscle are going to be get actually activated, to see the relative change in the timing of the muscle, to assess the motor control and the coordination, to determine any evidence of the spasticity, to evaluate the muscle function and the post-surgical transfer or management. So let's discuss and now the closing points of this lecture. Let's revise that what we have studied. We said electromyography is a clinical technique which is going to record the electrical activity of the muscle. And why we're going to measure this electrical activity, I actually want to get information about the structure and function of the muscle fibers so that we may compare it or we may get the idea that how we are going to progress and what would be the possible prognostic phase that we have. What interventions we need to do, what would be the short-term goal, and what would be our long-term goals. With this, I'm going to end up today's session that is was related to electromyography. In the coming lecture, we will be going towards the next coming topics that includes transcutaneous electrical nerve stimulation. We'll also study about the medium frequency grounds and other ways with which we can help the patients in getting well. Thank you so much. I'm going to post up this video in your Google Classroom and kindly go through this video and give a positive feedback regarding this. Allah Hafiz.